تعالى وبركاته. مرحبا بكم. ونحن في البداية أنا دكتور صديق فضل محمد. أول شيء نبدأ به هو ألو في صدى، ما فاهم الناس سامعاني. ألو
ايوه صديق، الصوت واضح، تواصل.
أيوة تمام. طيب، الحمد لله رب العالمين، والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد صلى الله عليه وعلى آله وسلم. أنا دكتور صديق فضل محمد، برحب بكم في هذا اللقاء البسيط والمتواضع، وهو جزء من أنشطة لجنة اطباء الخليج كمساهمة في التدريب ورفع الوعي فيما يخص الكوفيد 19. I will start this presentation by telling a very short story because I'm not specialized in this kind of presentation, but I would like to tell this story. It's back to 2015. I was in Ibn Sina Hospital خرطوم. بالنسبة للناس اللي عارفين الخرطوم كويس، في ابن سينا. Two young chops, they come to the clinic. I was in the gastrointestinal surgery clinic. For these two chops, they come in. They were asking about the urological clinic. Before I answered them, their mother stepped in, and she greeted me and she said, "You know, this is my sons." And very unfortunately, she told that one of them is a known case of chronic kidney disease with end-stage renal failure, and he was proposed to undergo renal transplant. Hello. طيب. And she
مسموع يا دكتور صديق، تفضل واصل.
Yes, she told that I am very. I'm telling this story just to open the presentation. I'm telling this story. Okay, she told that one of those sons is proposed to undergo a renal transplant, and they are sons and they are identical twins. One of them is the donor and one of them is the recipient. But the mother was very worried to attempt the surgery because she was having the fear to lose one of them or both of them. And you know that as a mother, she has two sons, one of them, and both of them, they go surgery at the same time. Okay, things goes on. We went together to the urology clinic and we met the renal transplant surgeon at that time. He was a visitor renal transplant surgeon. He is Dr. Al-Tayy. He is just volunteering to come from Europe, from the United Kingdom, to do renal transplant in Ibn Sina Hospital. He welcomed the boys, he welcomed the mother, he discussed everything for them, and he managed to treat the fear and the worriness about that lady. And fortunately enough, the surgery went smooth. Both of them, the donor and the recipient, they recover from anesthesia well, and both of them they benefit from the very tactile and angelical touch of that very common surgeon, Al-Tayy. And as we know, Al-Tayy is one of the first surgeons who died in the front line combating the COVID-19 disease. This very tangible story, very short story, might brings us to this presentation. Why a surgeon, me as a surgeon, presenting a lecture in an epidemiological science and public health science, because one of my colleagues preceded me and he volunteered and he lost himself in the front lines. So we will start By presenting this lecture, we will go through elements of contact tracing, procedures for conducting contact follow-up, contact database, required for contact tracing. طيب بالنسبة للناس الميكروفون منفتح شوية يحاولوا يصمتوا الميكروفون عشان try to keep your audio in silence so as we can go smoothly through the presentation. And as we know, since the COVID-19 hit the world in the late of 2019, and since we start in China and spread all over the world, it put a lot of burden in the health system. The necessity for implementing evidence-based strategic procedures to combat disease and to control the disease, it cannot be underscored at all. And as we know, contact tracing is one of the methods that prove to be very effective in controlling the spread of a pandemic disease or a disease that is spreading and outbreaking in an outbreak fashion. Like, for example, contact tracing helped controlling Ebola in 1976, and also it helped controlling SARS. So we have a previous experiences about outbreaks, about diseases that spread rapidly. The only way for combating and preventing the spread of those diseases was through contact tracing. So what are the targeted groups who can benefit from contact tracing? This presentation is intended to the frontline personnel, definitely healthcare workers, doctors, nurses, pharmacists, laboratories, even the housekeepers. Everyone who is working in the healthcare system and he is providing care for patients, he will benefit from this presentation because he will be the one who activate the contact tracing system. For example, if you are a doctor, you are working in the emergency department, one of the patients presented with symptoms and signs of suspected case of COVID-19, you can simply activate the chain of contact tracing. So everyone who is working in the health care system will benefit from grabbing a basic knowledge about contact tracing. Also, this is intended for epidemiologists and surveillance officers. For sure, for the epidemiologists and for surveillance officers, this is the piano through which they are playing their music. This is their field. Actually, we benefit from their knowledge. We benefit from their job. The epidemiologists, the surveillance officers, and those who are working in the public health, this is their career. Definitely, they will benefit from contact tracing and the knowledge of contact tracing. Volunteers. If someone wants to volunteer in combating COVID-19, he should grab basic knowledge about contact tracing so as he can provide a good assistance for the surveillance, he can provide good assistance for the epidemiologist, he can provide good assistance for healthcare worker. And not to forget, Ministry of Health, National Emergency Management Committees, and other decision makers. These are the stakeholders. The decision maker, they are the stakeholders. All the plans, all the efforts cannot be implemented unless we go within the policies of the Ministry of Health, unless we go within the policies of the National Emergency Management Committees, and unless we follow the policies of decision makers. So this presentation is intended for all these groups. So what is contact tracing? Simple definition for contact tracing is identification and follow-up of persons who may have contact or have epidemiological link with an infected person. Let me repeat again. It's identification and follow-up for a person who may have contact or epidemiological link. So the definition has 4 pillars. The definition of contact tracing has 4 pillars. Number 1 is identification. We need to identify through certain measures, through certain procedures, we need to identify the contact. The second pillar is to follow up. After we identify the contact, we need to follow up this contact. Okay. Again, we have certain procedures, we have certain measures, we follow them to follow up the patients. And to follow whom? To follow the contact for a patient or a one who is having epidemiological link with an infected person. We will come through that all, and it will be clear through while we are going through this presentation. Why should we do a contact tracing? This is a simple question. To answer this question, I will try to highlight the Italian model. In the beginning, when Italia declared the first COVID-19 case, and the health system notified there is an emergency, and the disease might involve the community, and like that, the notification was taken with some sort of lightness. It wasn't taken seriously, both from the community and from the policymakers. They didn't take the event as, seriously, and this, after just 2 or 3 weeks, this disease spread like just a fire in hay, and that after that the Ministry of Health comes to declare that the whole health system collapsed, simply because they did not follow and they did not implement measures for contact tracing of the infected patients. So what are the purpose of the contact tracing? The purpose of contact tracing is, number 1, providing optimal health assistance to the high-risk personnel. Well, this is one of the important risks. One of the important purposes, to provide optimal health assistance to the patient, to the person who is in high risk. And the second purpose is to interrupt the transmission chain through the community. So I have two purposes. Number 1, I want to help those who get in contact with an infected patient, to help them at least if they got the disease, I want to help them to pass through the time of the incubation period and the time of symptoms, and to help them to recover from the disease if they got the disease. And the second purpose is to break the transmission chain through the community. Well, before we continue, we need to have some information about what is called basic reproductive number. Basic reproductive number. What is basic reproductive number? It is the number of patients, the number of persons who contract the disease from the first patient. Is it clear? The basic reproductive number is the number of victims who contract the disease from the first patient. Suppose I have one patient positive for COVID-19, and this patient is able to infect, let us say, 3 patients. every one single case positive of COVID disease is capable of infecting 3 patients. So that means the basic reproductive number is 3. If the infected patient is capable of infecting 4, the basic reproductive number is 4. And the example, I think it's clear. If it is infecting only 2, the basic reproductive number is 2. Okay. The basic reproductive number depends on 3 factors. It depends on transmissibility, it depends on contact rate, it depends on duration of the infectiousness. I mean, if you want to calculate, if for the basic reproductive number to be, for example, 5, to be 6, to be 1, to be less than 1, to increase or decrease in its value, it depends on the transmissibility. If the disease, for example, is not transmissible, if you contact a patient with a non-transmissible disease, the basic reproductive number will be 0. But if the disease is transmissible with multiple methods of transmission, like for contact, like aerosol transmission, like droplet transmission, contact transmission, then the basic reproductive number will increase. And also it depends on the contact rate. What do we mean by contact rate? We mean how many times the diseased patient come into contact with the healthy person to give them the disease. How many times should I contact you, or should I contact the diseased person to get the disease from him? Is it one time, only one time? If I contact him for only one moment, for some very short time, is it enough? Or I need many times, long duration, long contact to get the disease? So if the contact rate is low, the basic reproductive number will be high. If the contact rate is high, the basic reproductive number will be short, and this is the vice versa. The duration of infectiousness, the shorter the duration of infectiousness, the bigger the reproductive number is. Okay. Here it's a simple diagram to explain the basic reproductive number. Let us say that one patient is capable of infecting 4 patients. After only one cycle, these 4 patients, every one of them, they will infect more 4 patients, and the total in the first cycle will be 4 times 4, this is 16. And if we go for a second cycle, then will be 16 times 4. And if we go for a third cycle, so it is a 4th arithmetic sequences. What is the cycle? The cycle is the incubation period. For the COVID disease, the incubation period is ranging from 1 day to 14 days. Okay, and if we take the median of this long duration, long incubation period, it will be like, let us say, 6 to 7 days. So every 5 to 7 days, I have a new cycle in COVID-19. Well, so let us go back and see what is the basic reproductive number for COVID-19. Actually, there are no certain studies that determine the basic reproductive number for COVID, but I think there are 2 or 3 only studies. One of them done in the diamond chip, you know, the American diamond chip. In day 1, there was, in the first week, there was only like 6 cases. In the 3rd week, there are about 368 infected persons. They did a study and they calculated the basic reproductive number in that chip. It's about 2.5. Until now, there is no a figure that can be taken as a basic reproductive number for COVID-19, but it varies from country to country. In Italy, it seems somewhere around 6. In China, it reaches 5 and then dropped back to 3. What is written in the WHO, it's an estimate between 2.5 to 3. So it's somewhere between 2 and 5 anyway. Even if it's 2, it's not a simple, and if it is 5, this will be a very, very, very contagious, a very highly infectious disease. Okay. For the basic reproductive number, why do we discussing the basic reproductive number while we are presenting a contact tracing presentation? Because me as a contact tracer, the contact tracing team, if they know the basic reproductive number of the disease of the COVID-19, they will estimate the number of contact. For example, if I received a letter that telling in certain area there is one positive patient of COVID-19, and I know that the contact, I mean the basic reproductive number for COVID is 4. That means every cycle, every patient will infect 4. After one cycle, this will be 16. After two cycles, this will be 64. After 3 cycles, this will be 128. So I will try to figure out how many contact will be carriers or will be infected with the disease in this community if I know the duration from the day which the diagnosis is take place. Let us say, for example, the diagnosis was 3 weeks ago. The diagnosis of COVID disease was 3 weeks ago, and the patient was wandering around, spreading the disease to the community. All right? And we know that the cycle of COVID disease is 7 days. So now I have 3 cycles. And the reproductive number is 4. So me as a contact tracing team, I can figure out the number of patients or the potentially patient. They should be the minimum of 128. It should be a minimum of that. This is why we are discussing the basic reproductive number for those who are going to participate in the contact tracing. Well, before going, there is one point I want to discuss, which is it's called, sorry for that. It's called super spreading event or super spreading personnel. What does that mean? To understand the super spreading event, we will go back to Korea, South Korea. And all we know, the case, 31 case. Hello?
واضح صوتك واصل.
Very good.
مسموع يا دكتور.
We will go back to
واصل.
تمام. We will go back to South Korea, and we know that the case number 31. Case number 31, it was diagnosed after, like, in the second week, I think, after the first case in South Korea. And that lady, from the point where she is diagnosed, she traveled about 260 kilometers to attend a church ceremony. In that church, there are about 500 persons sitting shoulder to shoulder with that lady, okay? And for, I think, about 2 hours after the ceremony finished, 2 weeks later, almost 2,600 person was diagnosed as a positive case for COVID-19. So what happened? What happened is this lady, in a matter of very few time, spread the disease to, like, let us say 500 persons. The basic reproductive number for COVID is just 4. If she stayed at home, and she limited her contact, or at least she is try to avoid contacting the others, the possible number that will get the infection will just be 4 or less. But because she is not following the guidelines, she did not abide by the instructions, she just, in a just simple short time, she spread the disease to more than hundreds, and these hundreds also spread the disease to hundreds, and just in few weeks, more than 2,000 people, they got infected with single person. This is what we call a super spreading person or a super spreading event. So the basic is not enough. If you are doing a contact tracing, you do the contact tracing, and at the same time you have to consider someone who is a super spreading. واحد يكون زي الحالة 31 دي. You have to put it in mind. Don't just take, if you find 128 after 3 cycles, look for more. I think my point is clear. Well, see here this is a comparison between COVID-19 and other viruses that cause an outbreak of disease. Ebola in 1967, this is the first viral disease through which we started all the information about contact tracing. We are gathering it from the Ebola case and the MERS-CoV also. And by the way, one of the very effective methods for contact tracing now is adopted in Taiwan, because they have the experience with MERS in 2003. Okay, and now they summarize their experience of contact tracing, and they are the very they are the leaders in the system of contact tracing. We will come to that inshallah soon. So who is involved in contact tracing? Contact tracing is an integral component of our all strategy for controlling outbreak. It is integral component. It's not one-man job. It's not one system function. All the systems should function together. All the health sectors should collaborate together. All the community parts should coordinate their effort together, from the security police, communications, lodging, food, the social, epidemiological teams, finance scholars, even the funeral organization, ناس منظمة حسن الخاتمة, they are involved in contact tracing, because every one of these has its role. ولو ما اتكاتفنا, unless we integrate our effort together, definitely there will be a chain break where the contact tracing will not be effective. What are the elements of contact tracing? The contact tracing have 3 elements. Number 1, contact identification. Number 2, contact listing. Number 3, contact follow-up. If we go back to the definition, we said that the definition of contact tracing is identification and follow-up of contact. So it has 3 components. Number 1 is to identify the contact. Number 2 is to list the contact. After you identify them, you list them. You create a list. And after that, you follow them up. Okay. So what is contact identification? How can we identify a contact? We will identify a contact. There is a definition through the case definition. We will identify the contact through a case definition. All persons who lived with the case in the same households since the onset of illness should be identified. All persons who visited the patient either at home or in the health facility since the onset of the disease should be identified. All places and persons visited by the patient since the onset of the illness should be identified. All health facility visited by the patient since the onset of the illness should be identified, and all persons who had contact with the dead body from a dead person who is either suspected, probable, or confirmed case should be identified. And for the contact team, during the visit, if they visited a community or home or a paid home visit for a patient, they have to ask about anyone who got exposed to the patient and not mentioned in the above list. All right. So all this, what we mentioned, they should be identified, and an identification of the contact بيتم عن طريق at least two identification by using the full name and the medical recording number, or if there is no medical record number, we can use the national identity number, or we can use the passport number. At least you should have two identifier tags to identify the contact. So what is the priority? The priority for contact is for the one who have a direct contact with the patient, the one who touched the patient's body, body fluid, I mean, blood, vomit, saliva, urine, feces, whatever kind of body fluid. The one who had direct physical contact with the patient, the one who cleaned the linens of the patient, the one who slept or ate in the same household as the patient, and the one who has been breastfed, definitely for infant and babies who got breastfed by an infected mother, lab workers who worked or handled investigation products from the infected patients without taking appropriate personal protective equipments. A patient who received care in hospital or care facility where a COVID-19 patient were treated before initiation of strict isolation. So if you have a patient who treated in a hospital where COVID-19 patient is receiving care and there is no appropriate PPE or infection control measures, all these patients should be identified and listed. Well, what is contact listing? After we identify the patient, now we have a patient. We follow up his contact, the area he visited, the patient, the relatives, the healthcare, those who got in contact with him. So we identify his contacts. What should we do? What we will do? We will do what's called contact listing. Sure. Number one, physical identifying every listed contact. Again, I repeat, identification. Identification should be done through two identifying tags: the full name or the full name and medical number, identity number, passport number, at least two identifying tags. The listing include inform them of their contact status. you should inform the contact that you have a contact with COVID positive patient. And what does this mean? What does being a contact of a positive patient, what does that mean? The action that will follow. And the action for a contact patient is like that. All contact patients should be isolated in health facility isolation. We have two types of isolation. We have community-based isolation, and we have, or at least let us say that three level of care. The first level is community care, community-based isolation. That is isolation at home. Two is health care isolation. ده ما بالضروري يكون في مستشفى، ممكن يكون في فندق، ممكن يكون في camp. It can be in a camp or in a hotel or wherever. But this camp, this hotel is under supervision of health facility, under supervision of Ministry of Health. So the action that's follow is to isolate them in a health care facility isolation. Okay, and one of the actions that should be followed is to be sampled. All of them, they should be sampled to take them what's called preliminary sample or the initial sample. طيب, listing include the importance of receiving early care if they develop symptoms. Them, tell that the patient, if you develop symptoms, please just report to the healthcare facility, just report to Ministry of Health, just report, you have to give them the way of reporting. And they report, and then after that, this will come in the follow-up. The contact should also be provided with preventive information. You should give them full knowledge about preventing the spread of the disease, so as they will not be a source for transmitting the disease to the others. Well, and the process of informing contacts of their status should be done with tact and empathy. Avoid using alarming information. Don't tell them that the COVID disease is a killing disease, the fatality rate is high. Until now, we don't have any kind of remedies or treatment for COVID. Don't break their hearts. They already have the pan الهلع في الناس كلهم موجود. don't exaggerate the thing. Don't increase, don't put more stress on them. Just tell them the simple, plain facts about being a contact of COVID disease. So after we identify the patient, we list the patient, then we have to do a contact follow-up. The contact follow-up team and their supervisors should be trained in one-day workshop to familiarize the team with basic information on COVID-19. كل الناس الموجودين في التيم of contact contact tracing team, they should have a workshop minimum of 1 day to get familiarized with. Number one, training package should cover the basic facts about transmission, preventive measures, rationale and procedure for contact tracing and contact follow-up. By the way, for the contact tracing team, it is not necessary to be a medical personnel. Everybody can participate in a contact tracing team, and he can be a member of contact tracing team. But they should receive a basic training about the transmission, preventive measures, the rationale and procedure for contact tracing, because they will be asked. They will face questions from the community. Why are you doing that? Why are you coming to, and why are you asking about like that? So they should have the basic knowledge that help them answer the community questions. Contact tracing team, they should have tools like temperature gauge, temperature monitoring. They should have tools for reporting, telephone numbers like that. If they found a case who is suspected to be positive like that, they can report. They also should be trained about recommended infection prevention and control measures for contact tracing team. They should be given an information about home-based preventive measures. Let us say after they find the contact and they list them, what they tell to the rest of the community, they have to tell them about the home-based preventive measures so as not to get in contact with others. This is simple diagram, a confirmed case, probable case or suspected case. You come identify the contacts according to the identification we mentioned before. And after we identify the contacts, we isolate them. We mean health facility isolation, not home isolation, health facility isolation. Any COVID positive contact should be isolated in a health facility. But then health support, what is health support? Health support include the primary sample and the antibiotic, food support, everything they need. And then you follow them up. To follow them up for appearance of symptoms and testing. After testing, either they testing, this is the final testing after 14 days, I mean. After 14 days, again, they will test. If they are, after 14 days, they have no symptoms or they test negative, then you will discharge them from the contact follow-up. Or otherwise, if they tend to be positive, then you will shift them to hospital isolation. And then you follow up accordingly. What are the necessary tools that is used with the contact team? Listing, contact follow-up list, reporting and monitoring forms, thermometers, alcohol-based hard ramp solutions, disposable gloves, COVID fact sheets and posters, protocol for reducing risk of transmission at home, guidelines for home-based care for symptomatic contacts, important communication means, like how can they communicate? They should have cell phones, they have phone numbers, anyway. I mean, they should be an effective communication mean that they can relay their information to the supervisors, either through call centers. They should have ambulance with them, because if they found a positive patient, they should have transferred this patient according to the infection control policies to the facilities that receive them and give them the appropriate care. They should have mobile phones with sufficient credit or other devices for supervisors. Fine. What are the procedures conducting contact follow-up? The contact follow-up team, they have 4 procedures. They have meetings. They in the meetings they discuss list of patients. How many contacts do we have? This should be daily done. They should be daily, around the hour, around the clock. They should have update with the number of contacts, and they should have listing of new contacts, because we know the spread of the disease. Every now and then there is a new list, there's a new number of contacts. They should have a meeting around the clock with updated lists. And this list should be communicated with the supervisors, between the supervisors and the tracing teams. The update information also from the health, like World Health Organization, like a Center of Disease Control. They should have update their information according to the new researches. Okay. This is a model for contact follow-up fund. It's not necessary, I think, now because we already outdated. This is not something new. Managing contact with symptoms. طيب, what should I do? As a part of contact tracing team, my role is to identify the contact, to list them, and to follow them up. So if a patient develops symptoms, what should I do? Definitely the contact tracing team is usually the first to know when the contact has developed symptoms, because they are following up their patients. They know that either because the patient volunteered the symptoms, or they paid a visit for them and they found that one of the patients have developed, one of the contact, have developed symptoms. So what should they do? They should immediately notify and alert the management call center. You are not responsible. You are just contact team. You are not responsible for the management. Your role is to raise the alert. You notify the treatment team through the call center, and the treatment team, they will complete the notification, the case notification. They have procedure to follow up. When to discharge a patient from, a contact, when you should discharge them from follow-up. For suspected cases that tested negative, they should be discharged. Contacts completing 14 days of follow-up period should be assessed on the last day, clinically and laboratory. If clinically they have no symptoms, and laboratory they are negative, then you discharge them. If they positive after 14 days, they don't have symptoms, there is a debate. Actually, it's not clear whether to continue on isolation and follow-up or to discharge them. After 14 days, the patient is not symptomatic. He has no symptom at all, but he tested positive. What should I do? Is this contact still infectious? There is no answer. So as there is no answer, we will consider them infectious. We will not discharge them until they test negative. All right. The team should spend time with, if you discharge a patient, if you discharge a contact to the community, you should spend some time with the community, telling them that this patient, this contact is no longer infectious, and he is safe, and he can start his regular social activities. Recommended safety measures for contact tracing team: they should avoid direct physical contact like shaking hands or huggings. They should maintain comfortable distance. They should avoid entering the residence. تدخل معهم في بيوتهم وتسكن معهم كمان. Avoid sitting in chairs like that. So the basic preventive measures that should be followed for preventing a COVID disease. Then how can we develop a contact database? A contact database طبعا عن طريق registration of the contact و production of daily follow-up reports. Production, a database should include all this: registration of cases, registration of contact, production of daily follow-up reports, production of predefined situation reports, exporting data in different formats: Excel, Word, HTML, websites, message text message, summary case and contact mapping, وvisualization of chain of transmission. واحدة من الأشياء التجارب الجميلة جدا جدا اللي هي تايوان experience. they do the contact tracing through the health card, the health insurance card, مع ربطوا النظام بتاعه مع الهجرة والجوازات. فأنت once you travel from anywhere to anywhere, the information of your travel will appear, any ticket, whether a local ticket or international ticket. Once you take that ticket, immediately it will appear in your health insurance data. When you visit anywhere, all the information just will appear. So الناس ممكن تستفيد من التكنولوجي وتربط الداتا مع بعض، وبالتالي تظهر المعلومات للناس. Thank you. Thank you very much.
شكرا دكتور